Hey, it's Luke from Justin and Luke. Our desire to focus on the healthcare industry started when we established Hip Creative, our marketing agency. We found that providing medical practices with a workable framework to attract more patients and grow their practice was something that we were passionate about and we were good at it. Now we want to push the boundaries and expand by providing training, consulting, and resources on how your medical practice can be optimized by recognizing that it needs to be managed like a business. Over the last few years, we worked with many leaders in the industry like Dr. Ben Fishbein, Dr. Jennifer Eisenhuth, and Dr. Eric Nielsen, and so many more physicians across the country. Today, I'd like to talk to you about common follow-up mistakes. By far, one of the major follow-up mistakes that a lot of medical practices make is giving up on appointment requests or leads far too quickly. Never forget that on average, roughly 80% of your sales will require no less than 5 follow-ups. With that in mind, how much money is your practice leaving on the table? People are busy these days. They're working 8 to 5, spam calls are at an all-time high, and to be honest, I think most people would rather receive a text versus a call because it allows them to easily screen who is contacting them and respond on their own time. So don't give up until you've reached out at least 5 times. Along those same lines, another common mistake involves jumping right into a discussion of price without first highlighting the value that only your practice can bring to the table. Luckily, this is also an easy problem to fix. It simply requires a small change in your point of view. If you really want to follow up with leads in the right way, you need to stop selling services and start selling value. What makes your practice different? Highlight anything that's unique about your practice, the doctor, or the culture. Focusing on value versus the price helps to build that essential credibility that will be the difference throughout the course of your relationship with the patient. Another major mistake that a lot of medical practices make when following up with leads involves not being able to answer specific medical questions or just questions about which services are actually offered at your practice. Nobody is saying that your front-end salesperson needs to have as much medical knowledge as a doctor with years of advanced education, but they should know how your business works on an intimate level, and if they don't know the answer to a question, they should know who to go to or how to find it out immediately. There needs to be a process in place for this, and I suggest role-playing to practice which sound bites flow and sound the best. If your salesperson doesn't know the answer to a question, it's bad. If they make up an answer or essentially guess and are later proven wrong, that's worse than saying they don't know at all. All of this underlines the importance of continuing training and education for the customer-facing team members at the heart of your business. As the old saying goes, you can only make one first impression, so you better make it a good one. If you have any questions at all about digital marketing, follow-up, or the sales process, please comment below or email us at hello@justinandluke.com. Thank you so much.